Okay, now this is a problem for that physician we're talking about, because their practice is no different from any other business. They have expenses on one hand, revenue on the other hand. If the revenue is not enough to meet expenses, that business is going to fold. And so that doctor cannot allow their practice to become financially insolvent. So what are they going to do? They're forced to do something. And despite what others say, physicians tend to be pretty clever. Not as clever as these insurance companies, mind you, but they tend to be pretty clever. And there aren't too many things that they can do to get around this problem. One is they can perform more procedures. They can see more patients within a given fixed period of time. And they can also raise their fees. And they're not doing this to get rich, mind you. They're doing it just to keep their practice solvent. Now let's consider what each of these tactics does. By a doctor doing more procedures, the more procedures he does, if he's getting paid for them, then it's going to be more income for their practice and help offset these low insurance payments. It also means lowering the threshold for which a doctor recommends that a procedure be done. Lowering the threshold of medical necessity for having recommended that procedure for the patient. It also means increasing the likelihood and number of frivolous cases. You say, how can that doctor do that? You know, isn't that illegal? No, I mean there was a reason to have recommended the procedure. It's just that the medical necessity sometimes dips low enough that there's not much benefit from having done it. It just increases revenue for the practice. It also increases overall healthcare costs. It has some other problems as well. One is that the more procedures you do, the more likely you're going to find some aspects about that patient that are not clinically significant. But in order to prove that, you have to do more tests, which further lead to increased healthcare costs. And also, with any procedure, there are risks, even though those risks might be very small. When you consider nationwide statistics, there are going to be some complications from these procedures that are being done, and they have to be dealt with, and that increases cost as well. Okay, so another tactic we're talking about is seeing more and more patients within a given fixed period of time. Seeing more patients through the day means more income for that day for the practice. It also means less time listening to your patients. It means less time for physical exam, less patient satisfaction and confidence in their doctor, less attention to detail, overall poorer quality of care, and in general a more tired and cranky physician. Okay, raising fees. Although raising fees, you might say, it does not do any good because I thought these insurance companies were giving you a fixed reimbursement. But it does do some good with other sources. So if you raise your fees, then that means more income from people who are private pay. It also means more income for people who do have insurance, but they're out of network. Also, insurances like workers' compensation and auto insurance means more revenue if you raise your fees. The problem is these other sources like this represent only a small percent of what we do. So if you're going to raise your fees in order to get more income out of those insurances, you have to really raise those fees. So what happens is skyrocketing, soaring healthcare costs. Now all of these issues probably sound very familiar from the news. You hear doctors are doing too many procedures, too many frivolous procedures. They're doing it just to get rich, line their pockets. No, they're doing it to try and keep their practice solvent. Doctors herd us in and out of there like cattle just in order to increase their income. No, they're doing it to keep their practice solvent. Also raising fees, skyrocketing healthcare costs, and yet quality of care outcomes are not going up. Okay, when we come back, I'm going to talk about my practice and give an example of how if we could get away from this insanity, stop the madness, how that we could see incredible benefits.